Hi, good evening, everybody. Welcome to my channel. Welcome back. Welcome back. This is the channel where you're going to get your coding information, interview information, tips, exam tips, motivation, all of those type of things. Don't forget to like, comment, and subscribe to the channel. All feedback is definitely welcome. So if you would like for me to make a specific video, or if you have a question about a certain video, please feel free to drop your question down and I'll be glad to answer it. So today's video, we're going to go over chart components and we're going to talk about E and M leveling. There's only about maybe 8 to 10 questions on the exam for E and M leveling. So it's real good to kind of go ahead and get that category down pat. So that'll be another category that you can ace, and then you'll have room to kind of, kind of slack off or mess up or kind of miss a few in another area if you have certain areas down pat. So some people who are into coding, just getting into coding, don't know what a chart looks like. So I wanted to go ahead and do that so you can know what a chart looks like. And I will tell you this, and if you are a beginning coder or if you're thinking about coding, this video is for you. Now, I won't go into grave detail in this video. This is just to get the gist of the basic foundation. So this is kind of for a beginner or for somebody who doesn't really understand E&M leveling. So let's go. Let's get into it. So here is a chart. Now and I'll put this disclaimer out at first. We don't have to worry about any HIPAA violations or anything like that because the names have been changed. As you can see, it says White Rabbit, and I'm sure you don't know anybody named White Rabbit. So that's out the way. So we don't have, this is an actual person with actual conditions, but the name and the protected information has been changed. Let's go. So this is one of my favorite charts, the charts, because they are very, very thorough. The chart is going to depend on the EHR that the physician used, which is the electronic health record system. And that's the system that the doctor, you see when a doctor comes around, he's always typing in the computer and things like that. So different doctors' offices, different hospitals, healthcare systems, they use different EHRs. So this EHR is from eClinical, and how I know, because I love eClinical. I've worked in eClinical for about 5 years, so I know what their charts look like. So let's get into the chart components. So this chart component is very thorough. That's one of the reasons why I like eClinical. Now, your components are going to be very important into coding because you have to make sure everything is captured, everything is there, so you can make sure you're coding everything that this person has or every conditions that this person has been diagnosed with. So it's going to be important for the physician to make sure they capture all of that. So right here, you see at the top is going to be the date of service, which is 5/21/19. Make sure that the date of service is always there on the chart. Also look for the physician's name on the chart as well. The physician, or whether here you see this is a physician assistant if you follow the cursor, but make sure the credentials is always there. Okay, so we have the current medications. I'm going through the chart components now, each element of the chart. So we have the current medications, and these are the medications that the patient is taking. That's going to be very important because the medications that the patient is currently taking is going to give us a glimpse of the conditions that the patient is currently struggling with or the patient currently has. Then we're going to have the reason for the visit. Now, on some charts, it's going to say chief complaint, and on others, as you can see here, it says the reason for the visit. Make sure the reason for the visit or the chief complaint is always there. And you see here, the reason for the visit here is a comprehensive visit, and they're doing fasting labs. So here is your history of present illness. This is going to tell you what the patient has going on currently at the moment, what they're being treated for, This is their history of the illnesses that they presently have. So I'll go back and we'll go back and read through the chart. But now I want to kind of take a look at the components first. So here we have the past medical history. This person has former heart disease, a history of prostate cancer. So the past medical history is going to also be very important. And it's going to be very important as well because it also gives us a glimpse into what this patient has wrong with them in the past. Because sometimes past illnesses can affect what you have presently going on. Okay, so now then we're going to go to the surgical history. That's going to be important as well, because there are certain surgical procedures that a person may have, and although those procedures are old, or they have happened prior or happened in the past, you still would have to presently code it. And I'll give you an example. I'm sure you guys have heard of a G tube, a gastrostomy tube, or a feeding tube. So if that surgical history has said feeding tube last year, then if this patient currently still has that feeding tube in, then I would code for the feeding tube. And the reason I would code for the feeding tube, because that lets anybody know who's reading this chart about this patient that this patient has a current feeding tube in them. So that's why this part is going to be important. Family history is going to be important. If you have a family history of cancer, then I know if you get cancer, or if we're concerned, if you have a lump or if you have a mass, then I can automatically know as the physician, well, hey, you know, he does have a family history of cancer. His mom, his dad, his siblings, his grandparents, all of those people in his family had cancer. So it's more than likely that he will too. So the family history is important. Then we're going to have the vital signs over here. Vital signs. Then we're going to have the social history. Social history is important. The social history asks things like, are you married? Are you divorced? How many children do you have? Do you smoke? Do you abuse or do you use drugs? Those things are going to be important as well, because if your social history is you having challenges in your social history, let's say you're going through a divorce or your children are misbehaving, those things lead to depression or anxiety or behavior problems. So to know about you socially, that's also going to give me a glimpse into your life. Do you smoke? Do you use drugs? Things like that. That's going to go under the social history tab. Then we're going to have the PE, which is going to be the physical examination. See here, they examine them. So this is the physical examination. Then we're going to have allergies over here. You see where it says shellfish. We need to know the patient's allergies. That's why every time you go to the doctor, the hospital, things like that, they ask you, do you have any allergies? Because that's going to be important in regards to the medicine that they can prescribe to you and things like that. So here's the assessment portion. After the doctor has talked to you to see what you're coming in for, they've given you your exam, they went through your medical history, your past medical history, your social history, and things like that, then they're going to assess what's wrong with you. So once they have assessed everything, here you go. These are the things they have assessed to be wrong with you. Here's the treatment. Under the treatment, it's going to tell you the things that they assessed, and it's going to give the treatment options. If the doctor wants you to start medicines, if they want you to stop medicines, if they want you to continue medicines, if they want you to come back for labs, if they want to order a diagnostic test for you, anything that they assess under the treatment plan, they're going to put down the plan for you under the treatment as far as how they're going to treat your issues. As you can see, long chart, still going. Oh, I might have went to a second chart. Let's see. Because I think I have two charts in here. Nope. Same chart, just a long chart. Okay, there it is. So let's follow to the end of the chart. Going back over the components, the assessments, the diagnostic procedures, if any were performed, the review of systems. And it says, see the HPI. You see where it says, see the HPI? The HPI means the history of present illnesses. Under the history of present illnesses, they reviewed certain systems. So they're telling you to go back and look up if you want to see the systems that were reviewed. So these are all of the things that were assessed about the patient. Let's go all the way to the end. And then when you get to the end of the chart, always make sure you look for the signature. Look for the signature of the physician. You see where it says electronically signed? And then also look for the date that it was signed on. Well, you see right here, signed off status is pending. It says it's pending. So you would definitely need the correct information to know, has this doctor already signed it? Because it said electronically signed, but here it says pending, so you can get the information for it. So now let's go back through the chart. And let's talk about E&M leveling as we go back through the chart. So this is just, looks like this was faxed over, so that was just the cover sheet. Okay, let's start. So we see the current medications. We see the reason for the visit is a comprehensive visit. We see fasting labs, which most of the time if you have diabetes and things like that, then you have to fast before you come and get your labs, things like that. We see off to the side your past medical history is heart disease and history of prostate cancer. So when they say history of prostate cancer, 9 times out of 10, when they say you have history, or 10 times out of 10 if you're following the guidelines, it means that this person no longer has prostate cancer. History means that you have a personal history of having cancer, but the cancer may have been eradicated, eliminated, whether it was by chemotherapy, radiation, medications, or things like that. So the history of present illnesses, let's go through this. And we're going to level this and give this an E&M leveling number. It does not say new patient. Usually when there is a new patient, it will say new patient. So this is not a new patient. And also you can tell it's not because it has past medical history. It looks like this physician already knows about this patient. So it's not a new patient. And of course, you know, with E&M leveling, to find your CPT code that you're going to use, it depends on if the patient is new or the patient is established to their practice. So your history of present illnesses, new symptoms, it said patient presents for a comprehensive visit. Patient has CAD, which is coronary artery disease, history of CABG, and that's a bypass graft. A lot of these abbreviations you'll know once you get into coding or once you learn more about medical terminology. And that's a great course to take before you get into coding, or as you are taking a coding course. Medical terminology is going to be very good for you to have because you'll automatically see abbreviations like this and you'll know exactly what they mean without having to stop and look them up. And that'll take time away from you coding. So this patient has CAD, which is coronary artery disease, history of CABG, which is a history of the bypass graft. This patient has high cholesterol and hypertension. He is followed by Dr. Sandoval. His last appointment was March 2016, which we know now this is May of 2019. And if you're doing E&M leveling, if the patient has been here within 3 years, then you're not a new patient. No medication changes, and he will continue yearly follow-up. So he's saying there is no medications to be changed. Pay attention to everything. Make sure you thoroughly read the chart. Follow the cursor, and here we go. He is being treated for HTN, which is hypertension, which is the same thing as high blood pressure. So he's been treated with hypertension and CKD, which is chronic kidney disease, stage 3. Followed by Dr. Zuderwig, that's the nephrologist. And then it tells you what type of medicines he's on. It gives you all the medications. And then it tells you his last visit with the nephro doctor, with the nephrologist or nephrology, was in December of 2016, which is roughly about 3 years from this visit. Almost 3 years, but not quite. And it says this patient is denying SOB. You know what SOB is? Shortness of breath. That's why I said medical terminology is going to be very important. So this patient denies shortness of breath, edema, which is swelling, fluid. When you hear somebody say they got fluid on their body or the legs swelling up, that's edema. So difficulty urinating, tolerating medications well. It's telling you everything about this patient's history. He has hyperaldosteronism and stable adrenal adenoma. It's a part of cancer, a different form of cancer over the last 7 years, and he's being monitored by the physician. The last MRI was in March of 2015, and he has persistently low potassium. He takes potassium supplements, multiple renal cysts, which are benign, which saying he has multiple cysts on his kidneys, but they're not cancerous. So if you see the word benign, it's not cancerous. He has a history of prostate cancer. So it says he was following this Dr. Lipson, which is the urologist. And he followed up November 2016, demonstrated no evidence of recurrent disease. So let you know, that's why it's telling you it has a history of prostate cancer, because there's no evidence that he still has it. It's gone. That's why it's a history of it. If he still currently had prostate cancer, it wouldn't be a history of. So the PSA was completed, and it's like a lab to kind of test your prostate enzymes and things like that. So that was completed in November 2016. He continues to follow up with urology yearly. He is followed by core, Dr. Wall, for rotative cuff syndrome of right and OA of the right knee. OA, osteoarthritis. The pain is stable. He applies ice when it's swollen, and he continues to exercise 5 days a week. Okay, so here are the vital signs. You see all those things he had wrong, correct? Okay. Because the video is getting long, so I won't go back through it when I switch over and talk to you about E&M. So here are the vital signs. Here's the exam. General appearance, alert, pleasant, and no acute distress. Well developed, well nourished. Nothing is wrong with this patient physically that he can see off the top. No distress, nothing is wrong. So here's the neurologic portion of the exam. The patient is alert. You're oriented. Your cognitive exam is grossly normal, which means your thinking, your coordination, all of that is on point. Your cranial nerves are intact. You know how they feel on your head and make sure everything's together. Your gait is normal. Your balance and all of that is good. You don't have any tremors. They did a sensory exam, and that's intact. They also did a psych exam. Psych exams are important as well because it lets the doctor know if you have depression, anxiety, mood changes, schizophrenia, things like that. So the psych, pleasant, alert, oriented, cognitive function is intact. Judgmental and insight is good. So there's nothing psychologically wrong with this patient. So the general exam, they did a general appearance. They checked the neurology part of them and the psych part of this patient. So here comes the assessment. The doctor is now saying, after I assessed all these things, after I went through your social history, your past history, your current medications, your vital signs, I examined you. Now this is what I am finding that is wrong with you. Okay. So you have adrenal adenoma, which is cancer. When you see this adenoma, carcinoma, all of that, that's cancer. Left side. Here's the code. And when you see codes inside of the assessment, don't always code by the assessment. It could be wrong. It could be wrong. So make sure you double check. Sometimes it may say just adrenal adenoma. The left is off. But if you go back and read inside the chart, it may tell you which side. So don't always go by the bottom assessment. Always kind of look it up for yourself as well. So now this physician has found that this patient has adrenal adenoma, left side. You have high cholesterol. And when you use this code E7800, that's the code for cholesterolemia. I'm sorry. Because you can use E78.5, and that's hyperlipidemia unspecified, which is kind of like hyperlipidemia is the same thing as cholesterol, but it gets more specified. And you guys know with coding, the highest specificity is what we're looking for. So now we see this patient has stage 3 kidney disease. We talked about the CAD, which is the coronary artery disease of the native artery of the native heart with stable angina. They have chronic hypokalemia, multiple renal cysts, and keep in mind we read all of this in the HPI and exams and things like that. History of coronary artery bypass graft. That's when I said, when I showed you the CABG, that's the graft, the procedure that they had. Hypertensive chronic kidney disease with stage 1 through 4. A lot of times when you have hypertension, which is high blood pressure, and when you have kidney disease, they are linked. Even if the physician does not link them in the document, when they have them together, you can link it unless the physician says it is not linked. That's the only time that you can't link them. If they tell you specifically, this hypertension is not linked to the CKD. But most of the time, it's linked. We have the history of the prostate cancer. We have the hypoaldosteronism. We have the adrenal adenoma, and you see where it says down here, unspecified laterally, but up at the top, let me show you again, it told us on the left side. That's why I say you can't always go by the assessment. So now we also talked about in the HPI, the rotator cuff syndrome of the right shoulder. Here it is. So now we're talking about the treatments. For the adrenal adenoma, it's going to tell you to continue to follow up with the nephrologist, which is the kidney doctor. High cholesterol is telling you what to do to continue your meds and follow with the cardiologist. Your chronic kidney disease, stage 3, is telling you to follow up with the nephrologist. So we see a few chronic conditions. We have high cholesterol, which is chronic. You have the chronic kidney disease, which is chronic. CAD is chronic. Then you see he has the chronic hypokalemia. You have a lot of chronic conditions. Okay. Here it is as we're ending the chart. So basically these are just labs and things like that. You know, you had your complete blood count. You did your protein, your calcium. They're just checking all of these things. So now let's head over to this E&M. Let's head on over. So I got a double screen here so you can kind of see it. Double screen. It should help. I'll back up a little bit so you can see it. Okay. So from the presenting problem to the code. And I'll start over here. You see where we have 99215, 99205. You see where we have 99214, 99204. We have 99213. We have 99203. So that's going to be